Hello and welcome. This is Dr. Fizan Khan, and you're watching Healthy Mind. Today we will discuss ECT. ECT stand for electroconvulsive therapy. Okay. सो आपने सुना होगा कि मुख्तलिफ साइकेट्रिक इलनेस में जो है ECT दी जाती है। तो आज हम समझेंगे कि ECT क्या होती है। तो मैंने मुख्तलिफ जो है रिसर्च करके जो है ये तैयार किया हुआ है। तो ECT जो है इसको हम शॉक ट्रीटमेंट, इलेक्ट्रोशॉक ट्रीटमेंट, करंट ट्रीटमेंट या ब्रेन स्टिमुलेशन ट्रीटमेंट भी कहते हैं। इसको हम डिफ़ाइन कुछ यूँ करते हैं कि इट इज़ अ प्रोसीजर, इट इज़ अ प्रोसेस विच इज़ यूज टू ट्रीट द सीरियस एंड इमरजेंसी साइकेट्रिक कंडीशन. For example, a patient which is not controlled, which is very violent, so that is controlled by ECT. It is used in condition like postpartum psychosis. The postpartum psychosis, mania not controlled by drugs, medication, patient which doesn't take medication or refuse medication, suicidal risk patient, negative symptoms, schizophrenia not responding to medication, and catatonia are posturing, that is the disorganized behavior in the schizophrenia. So जब आपसे कोई पूछे कि what are the indication of ECT, so you should know. Then we have the types of ECT. So number one is the unmodified ECT. So unmodified ECT is without anesthesia and without muscle relaxant. Modified is with anesthesia and muscle relaxants. Unilateral, given on one side, either on the temporal or on the frontal part, and bilateral, which is given on both temporal or both the frontal and the occipital. So that is bilateral. So total there are 6 types of ECTs. Okay, unmodified, modified, unilateral, bilateral, temporal and frontal. So these are the types of ECTs. Nowadays the used ECT is a modified, and in the modified there is again ECT in which there is anesthesia is given, in which muscle relaxant is given. Then we have the history of ECT. So the history of ECT starts with the biological antagonism theory. The biological antagonism theory suggests that one disease induction or one disease production treats another disease. Okay, and there was found an inverse relationship between the seizure and psychosis. Okay, that in a patient, if there is seizure, there will be no psychosis, and vice versa. So the pioneers of ECTs are the Ugo Cerletti and Lucio Beni. So Cerletti and Beni started the electroconvulsive therapy. Initially there were chemically induced seizure, then electrically induced seizure, then modified ECT with anesthesia and muscle relaxant, and then monitored modified ECT, which give you the blood pressure, the pulse, the saturation of oxygen, and also the EEG waveform. Then we have the mechanism of action. The initial were that it reset the brain function. Okay, it treats the disorganized behavior in psychosis. Secondly, it breaks the blood-brain barrier. So the toxin which are produced by the brain, they moves out easily, and medication can enter the brain easily. Third is changes in neurotransmitter like dopamine, adrenaline, noradrenaline, and serotonin. And fourth is that psychiatric illness are inflammatory in nature, and ECTs releases cytokines, and that cytokines treats the inflammation and prevent the neuronal function. So that is the mechanism of action of ECT, which has been contributed throughout the time. But the new research which has been made, that was made in the 2016, and that suggests the genetic changes and the neuroplasticity, and that is the current research. Now, let's look into the parameters of ECT. The voltage is 70 to 120 volts, duration is 0.7 to 1.5 seconds, frequency is 3 times per week, okay, and the total number of ECT can go up to 25. So these are the MCQs, or these are the academic points which you have to learn. The current is not mentioned, that is 200 to 1600 milliamperes. 200 to 1600 milliamperes. So these are the parameters of the ECT you should know. That this is the modern theory of gene expression and neuronal plasticity. सो ECT क्या करता है कि वो मुख्तलिफ़ जीन्स की एक्सप्रेशन करता है, और फिर मुख्तलिफ़ प्रोटीन्स प्रोड्यूस होते हैं जो साइनेप्टोजेनेसिस, यानी जहाँ पर दो न्यूरॉन मिलते हैं, न्यूरोजेनेसिस यानी नर्व ग्रोथ, डेंड्रोजेनेसिस डेंड्राइट्स जहाँ पर एक न्यूरॉन मैसेज रिसीव करता है, एंजियोजेनेसिस blood vessel synthesis, gliogenesis, glial cells in the CNS synthesis, or glial cells are the supportive and nutritive cells of the CNS of the neuron. Then also there is change in the brain volume, okay, the different areas in the brain like hippocampus, amygdala, cingulate gyrus, and the temporal cortex, which are related with the psychiatric condition. Now, controversies about ECT. Why ECT is controversial? Okay, they are controversial because of the negative perception, negative image presented by the psychiatric staff. Like its message is given like the punishment to the patient, that if you will not calm down, we will give you ECT. Then giving ECT without consent make it a stigmatic. Then exaggerated by media like the movie One Flew Over the Cuckoo's Nest. This give the very big stigma to ECT. And then the concept of brain damage and memory loss. Now, society and science comparison about ECT. So society stigmatize ECT, while science and medical field shows the evidence that the ECT has role. And nowadays also the TMS, that is the transmagnetic stimulation, is also used, so means that it has a future. Now, side effects of ECT include the temporary memory loss, confusion, headache, nausea, and bone fracture at old age. So this was all about the ECT, electroconvulsive therapy, its definition, its indication, okay, its history, and then why it is stigmatized in our society, and its little bit side effects after the ECT. Thank you so much.